This is Emily Rubin, dietitian with Thomas Jefferson University Hospital and PR chair for the Philadelphia Academy of Nutrition and Dietetics, presenting you with the nutrition tip of the week. Bloat is a word I hear multiple times a day by my patients, especially with irritable bowel syndrome. And irritable bowel syndrome month is April. So we've been searching for an IBS solution for years. Millions of Americans are estimated to have IBS, up to 15.3 million, according to the NIH. In fact, IBS is the second leading cause of absence in school and the workplace following the common cold. We know that patients with IBS poorly absorb certain foods, but this malabsorption can definitely lead to digestive woes and symptoms. For a long time, we didn't know how to accurately identify or remove these offending foods from the diet of IBS patients. Then, in 2010, a scientific breakthrough, more precise dietary treatment of IBS came about. Dietitians called this breakthrough FODMAP. Put simply, FODMAP is an abbreviation comprised of the first letters of various sugars and carbohydrates that naturally occur in foods. These sugars and carbohydrates are the culprits that cause the bloat, the pain, gas, diarrhea, constipation in many of our IBS sufferers. A food can have a high FODMAP, a low FODMAP, or no FODMAP at all. It is also important to note that the serving sizes can also change how well a person tolerates a specific food. For example, having a large amount of a low FODMAP food could turn into a high FODMAP food. Limiting a patient's diet to foods that are low FODMAP can actually reduce IBS symptoms up to 80%. Well, that's definitely very helpful these days. The first step is to remove potential trigger foods from a patient's diet. It includes anywhere from a 4 to 6 week period of time. Then, with the help of a registered dietitian, one problematic food at a time is slowly reintroduced to the diet to see if a patient can tolerate that food. Once that food has been dealt with, a second trigger is reintroduced, and so on and so on. Some of my patients have been able to reintroduce and enjoy foods with high FODMAP levels. Others must stay on a more restrictive FODMAP diet. Sounds great, right? It is, but you should know that it is not an easy diet to follow faithfully. You have to plan your meals, shop carefully, and read all the labels from top to bottom. Most of all, you have to try to be compliant for the entire 4 to 6 week period. However, if you can hang in there for the initial period of a diet, chances are you're going to feel better. Next week, we will discuss the more specific foods of FODMAPs. This is Emily Rubin, dietitian with Thomas Jefferson University Hospital and the Philadelphia Academy of Nutrition and Dietetics, wrapping up the nutrition tip of the week. For more information, you can log on to yourradiodoctor.com.